The one blood test that I would recommend to be done frequently is a complete blood count, which we also call CBC. Hello, I am Dr. Soumya Bhattacharya. I am a consultant hematologist, hemo-oncologist and BMT physician attached to Apollo Multispecialty Hospital, Kolkata. In my practice, I see plenty of hematology patients and they often do incomplete tests. For example, they will come to me just with a plain hemoglobin report. I must emphasize that a plain single hemoglobin report doesn't signify anything to us. We need the complete blood count, which contains the hemoglobin, the red cell count, the WBC count, the differentials, the platelet count, and parameters like packed cell volume, MCV, MCH, and MCHC. And all these combined gives us the report complete blood count. And how does complete blood count help us? It helps us to identify whether the anemia is secondary to iron deficiency, whether there may be something else going on, for example, whether there is any B12 deficiency or folic acid deficiency. And if there are blasts in the peripheral blood, then it can give us an idea whether there is a cancer lurking somewhere. If the platelet counts are low, it can give us a hint of diseases like immune thrombocytopenia. Obviously, just a plain single blood count won't do. What we require is subsequent tests. For example, there can be kidney problems giving rise to anemia, so we often do renal profile. There can be liver problems giving rise to anemia, so we often do liver function tests. Thyroid problems can give rise to anemia, so we do a thyroid profile. Sometimes the diagnosis can only be obtained by doing a bone marrow test. And so in some of my patients, I do bone marrow test. We sometimes deal with thalassemias, and their hemoglobin electrophoresis or HPLC is a test that we do. In certain cases, we deal with lymph gland cancers like lymphoma, and in those circumstances, lymph node biopsy becomes very important. And in the same vein comes radiological procedures like CT abdomen, CT chest, CT scan of different parts of the body, and PET-CT. These tests provide us with the information required to treat these hematological conditions. We often do iron studies, B12 studies, folic acid studies, which we call testing for hematinics. And once these tests are done sequentially and in a planned and phased manner, we can get the diagnosis of the vast majority of hematology conditions and can give appropriate treatment. So, in modern day, a lot of these hematological conditions and even cancers are treatable, and one test that one should do before anything and before coming to us hematologists is a complete blood count, or I repeat, CBC.